don't forget to log out because it's me. It's my thing. So at the end of the day.
So this is recording. It has started recording, so got everything. I'll be right back.
Okay.
All right, so we're gonna get started because it is right on time. I am very excited to be here. Actually, it's been a while since, well, Richie and I did this cohort 5 last year virtually. And so it's really exciting to see all of us come back together. Prior to that, we were always here or at the Sawmill campus, one of our other offices. So it's just really excited to be back here to talk to you all about a lot of the work that we do with the Juvenile Justice Policy Oversight Committee. So before we get started, I know that Richie mentioned we'll do a little round of introductions because I recognize some of your faces and then some of you I don't know. So would love to be able to just see, hear your name, the agency you work for or the organization you work for, and just a little bit about your role, if you don't mind.
Mike Costco, I'm the youth prevention specialist for the town of Guilford with the Guilford Service Department. Programs as well as prevention. And I co-chair the
Jessica Rizzo, I manage people PCS.
Oh, good. Thank you.
I'm Janessa Taylor, so I look for guys.
Welcome.
Paul Finch, Sergeant at the Business Department. I currently in charge of the recruitment background team. It's been about a month.
Oh.
Currently.
Thank you.
John Watts, probation officer in the building. I've been CSS lead since 2002. And I currently supervise the emerging adult population 18 to 25.
Yeah, it's oh my gosh, what was that team called for specialized supervision for the emerging adult?
Unity.
Unity,
Yeah,
yes.
you're probably familiar with Unity, but
Yeah.
some people know it, but it's emerging adults more.
Well, yeah, okay,
interchangeable.
perfect,
Yes.
great, that's great,
Yeah.
thank you.
You wrote for the work for the department, right?
Nice to see you in person. We've been meeting and virtually for these past year and a half. So it's great. All right. You'll see. We'll talk more about that. Yes, I was just gonna say, I was looking at your face. Oh, you know, sorry. Still, I want to know you. I'm sure I've seen you all in the meetings and so forth. Yeah. Okay. Well, thank you all. Some of you, many of your agencies I've worked either in or have worked very closely with in the sense of partnership and collaboration. And so it's really exciting to kind of just hear where you're coming from. A little bit about myself. I'm not gonna dive too much. I don't know if Richie. Oh, sorry.
I can sit over there.
I don't know if Richie and
I could just.
yeah, thank you. So a little bit of myself. I actually have been with the TYJI Justice Institute. It'll be 6 years in April, and came in to work as the director for the Juvenile Justice Policy Oversight Committee. And I'm now the associate director of the institute. Prior to that, I was at Judicial Branch for Court Services Division, and I worked 2 specific areas. Didn't want to necessarily, I love the juvenile work, but I also love the adult work. And I know that, you know, when one of the things that I wanted to make sure that I was very much a part of is that it's about prevention, right? And so our goal is that we don't want, if a youth is involved in the justice system, we want to hope that at the end of whatever intervention or service that they've received, they're done and they don't recidivate, right? But unfortunately, some of our kids do. And so they end up in the adult system. So one of my things was at Judicial, I came in to work for, at that time, it was called the Center for Best Practices. I worked there and I helped develop and implement programs in the community and working with probation, the detention centers and so forth on implementing best practices. Sorry, it is hard to talk and breathe at the same time. Oh, smoke. Did that and working at the Center for Best Practice, we made sure that, so for example, gender responsive probation on the juvenile side or on the adult side, which was the women's offender abuse management model, WOCA. I came in, I trained staff in that specialized unit. I also trained in gender responsive services. I also did a lot of work with quality assurance and CSSD, which I know they still very much hold this to be true, had a contract with CSI, which I can't remember the name of the organization right now, but it stands for, but CSI to do quality assurance. And so I worked with them in implementing it not only with their providers, but also with probation. I know it was, it was a lot of work, but it was great. I loved the experience. I was with CSSD close to 9 to 10 years. Left there to come here. Dr. Bill Carbone, which some of you know, recruited me and wouldn't stop. And so left Judicial, and then prior to Judicial, I was living in New York, and I was working in accreditation. It was an international national organization that looked at best practices for state agencies. So what does the research say about programs and how state agencies should implement those programs? And a lot of state agencies are accredited for their programming services, whether it's like a MYI accredited, detention centers accredited, probation accredited. So I worked with a lot of the state agencies across the country to receive their national accreditation. And then I also did a lot of consultation with nonprofit agencies for their accreditation. So Wheeler, prior to that, case management services and so forth, specifically worked in emergency local services when I was doing direct practice and homeless shelter for family. So that's me in a nutshell. I would say that one of the things about me, and you'll hear a lot about this, hopefully you don't hear about, and we talk a lot about it, is policy work. I'm one of those crazy people that love policy work. And I just find it exciting. I find it, I know it's boring, and I'm not talking about reading a manual. I'm talking about actually brainstorming with people, right? About something that's effective and something that's not effective, and how do we make it effective? How do we know that the assessment tool that you're using with your population is actually getting you the information that you need to provide the effective service? That is policy work. That's coming up with a strategy, doing some research, coming up with the barriers, and then figuring out, once you implement it, how do you know that the outcomes that you're, the outcomes are effective? And so I love that piece of work, and I find it very interesting. And the main part that I find interesting about it is the collaboration, the brainstorming, hearing from people about what's working and what's not, and really working together to come up with solutions. Before we get into the evolution of JJPOC, I want to ask you all, raise a hand. Some of you already know this, but answer, but raise a hand. How many of you have heard of the Juvenile Justice Policy Oversight Committee? Prior to coming to the transforming utility, okay. How many of you, well, actually, before I ask this, what are you, just overall, good, bad, indifferent? No judgment here, it's a judgment-free zone. What are your thoughts overall from the things, for those of you who have heard of the JJPOC, what are your thoughts? Big picture, just throw out whether it's effective, not effective, good, bad, don't care for it, whatever. Those are,
I think that for the agency I work for, they keep us on our toes. Responding to the recommendations that they give us.
if you could write a process. Process agenda. Taking into account feedback.
Informing the agency. The agencies can't those that understand practices and research around the world. I know that our agency is currently doing research so we need to inform best practices.
Their political stance.
Very early on when we got public. I thought it was really the person I had seen things brought to light that were concerns from everybody, but nobody said it out loud. And I thought some he really worked with Cohort and TYJI and that movement. I thought I can't imagine another place where that would have been brought up and changed so quickly.
Yeah. So, yeah, perfect. That's great. Thank you, Richie. So, actually, if you can add, just so that I remember my train of thought, strategic and transparency. So, thank you. And so we'll go into a little bit about the JJPOC and the makeup of itself and how it works and the process. Because transparency, understanding the process of a pretty powerful committee in the state of Connecticut, okay, is important, right? Other things that you noted is the transparency piece, but I think it was actually you that said the secrets behind it, like what's happening. At what point does it get to be public, even though these are public meetings? At what point do we see the behind the scenes information and hear the behind the scenes information in the general public, right? So that the general public can have feedback as well. So again, transparency. And then we'll talk a little bit about the strategic piece of things. So just a little bit of the evolution of JJPOC. Some of you already, you mentioned this. So the Raise the Age, many of you were probably around in Connecticut working around the initial Raise the Age. And at that time, this is how creative we all are in policy work. At that time, it was called the JJPIC. The Raise the Age efforts, there was a committee in place. There actually was two committees. You all may remember the JJPIC, which was responsible for the raising of the age, doing the research. What are the best practices? Should we in Connecticut move towards that raising the upper age of jurisdiction? And how do we do it? How do we implement it? What does the research say? And that committee was responsible for monitoring and holding accountable the larger system for that Raise the Age implementation. The second committee actually was, at that time, if you all recall, was our first round of decriminalizing the status offenders. You all remember status offenders used to be referred from the schools for truancy to the courts. Best practices say, why are we doing that? They didn't commit a crime. Runaways, we used to refer them to the courts. Why are we doing that? That is not the appropriate service for them. So at that time, in 2005 and 2006, both of these things were happening. The decriminalization of status offenders basically saying we shouldn't be referring these children to the court system, but we should be providing alternative interventions in the community. And so there was a committee also just as powerful as the JJPOC or the JJPIC. And so these two committees were meeting regularly. And that was to monitor the implementation of these two major initiatives in Connecticut, which we actually became very well known for nationally. Bless you. We became very well known nationally because we were one of the first states to raise the upper age. We were also one of the first states to decriminalize status offenders. So what happens is when you don't have other people to follow, and come up with they try to figure it out themselves, right? So these committees were meeting monthly to evaluate the progress of the implementation of both these laws, significant changes in the law. So fast forward few months, not months, years, excuse me, few years, and it's like 2013, 2012, raise the age has happened, decriminalization of status offenders has happened, meaning that they're not referred to the courts, but they somewhat are. They're getting access to community-based service instead of being on probation, because illegal detention centers could not take them in because status offenders should not be in the detention centers. And so, fast forward all that, those implementations of those reforms have happened. But people started asking, well, what's going on in Connecticut? How do we know that the changes that we made, the significant changes that we made, are actually effective? And so we are, questions were being asked, couldn't really answer those questions. We have state agencies who get a lot of data, but who's evaluating that data? Is there a third-party person coming in to say, hey, you're doing it right, or did you know that by creating this change, you actually have more brown and black children in prison or in the detention centers or at whatever? And what's happened there? So this is the adverse effect to this reform. So fast forward, Representative Tony Walker who was spearheading the initial JJPIC and the Raise the Age said, we need somebody out there evaluating this system again. Like we need to keep, we need to know what's happening. And so the JJPOC was formed. It was basically brought back to life. It was the JJPIC. It evolved to the JJPOC. A lot of the same key players from the JJPIC are members of the JJPOC. But we've added new people. So we'll talk a little bit about who those key players are because it's important in the work that we're doing. And again, the overall, the formation in 2014, it was put in law that a new policy, a new committee would be, legislative committee would be formed. It is spelled out who the membership was going to be, representation from the Department of Corrections, judicial branch, nonprofits, community, representation of children and family, first and second hand experience, so forth. We have a total of 41 members, the next slide, 41 members who are appointed to this legislative committee. The committee is actually, that number is a false number because there are, in legislation, it says these 41 people from state agencies or nonprofits or advocates or whatever may be represent shall be the appointed or the voting members, but they can appoint somebody. So most people do appoint people. And so we have a total actually of 63 people. I just did that count not too long ago. We have a total of 63 people that represent the JJPOC. Not all 63 people vote on these recommendations. We'll talk a little bit more about process and all of that, but not all 63, only the appointed 41 members are the ones who are allowed to vote. If on a day that we're holding a vote, that member is not available, their designee can vote for them. But that's sort of like the makeup of how, or the history about how JJPOC came to be. Before I get into this whole process, coordination, planning, because I promised both Richie and Devin that I would do this, I want to make sure we talk about, and some of you commented on this, and we talked about this transparency, concerns about or doing research around best practice, how do we know things are working, the political stands of people, where people live, where people sort of fit in whatever politics we are in, doesn't matter. And I'm not going to get into the world of politics, but that impacts decisions that are made, right? But so I want to talk a little bit about this. It's this program does talk about leadership skills, characteristics, collaborative work. But I want to talk about, you heard me mention the JJPOC, how it got formed, the history of it. Now that you can all throw out to me qualities of what it takes if you've been part of it, whether it's in your office, doesn't have to be big scale, whether it's in your office, your own personal life, because you have an interest in advocacy work or whatever it may be, you may be a mentor to somebody. But what does it take, you think? What are some of the characteristics that it takes to create or build reform? What are some things that we should be paying attention when we say we want to make a change in something? That's what reform is, right? We want to reform something, we want to change something. Good, better, and different, whatever it is that you decide that change, that something needs to be changed. What are the skills or what are the steps or process that it takes to do that?
Being critical of the original system or some type of critical analysis.
Critical analysis. Yeah, critical analysis, okay, of the system.
Being able to identify
Deficiencies
or strengths.
or strengths, yeah. Courageous conversations, yeah.
You have to have understanding and knowledge of the population.
And some being or be educated, be understanding of who that, what it is that you're trying to create impact on, that community. Yeah.
It's being okay with, the fact that not everybody's been the same.
Yes. That's a big one. I'll tell you, yeah, we can elaborate on that a little later, yeah. Others? So we have that critical thinking, critical analysis, we have understanding the population and community, we have the differences of opinion. Okay, so a few others that I'd like to add to that, the champions. Because sometimes not everybody who's going to be tackling that is going to be your person that's in the front lines, right? So sometimes you have the people behind the scenes. So your champions. The critical discourse, which is, I think somebody was mentioning the critical discourse is important. You also, some champions, perfect. And then what about consensus building? The steps or the strategies, or yes, you have that critical discourse, but you can always end up having a critical discourse and never come to the middle ground, ever. And you're just stuck in that rotating cycle. And sometimes, have you ever been to a meeting where you feel like we've had this conversation over and over again, and we can't get over this, whatever this hurdle is, whatever this problem is. So at some point, not everybody's going to end up on the same page. But how do you make decisions about when do you move on? So you need that consensus. Okay, and then the other one, and I think it kind of ties a little bit of this, but evaluation, outcomes and evaluation, right? So we, and I'll get into a little bit more, but I want to throw all these ideas out because then we'll get into the sort of the nitty gritty about JJPOC and sort of the behind the scenes work that we do. But outcomes and evaluation, one of the things that bugs me the most in policy work is people say that policy is not working. So we're gonna throw it away, change it up, and I have a great idea. And it's one person who comes up with the idea, comes up with the strategy for how to do it, changes the policy, and then before you know it, it's sent out to your, your all personnel email, says this is the new policy. Was there any discussion about was the policy working or not? Yeah. So goals. Yeah. Goals. Yeah. 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 And so if you make a policy change, that policy change better be feeding into the success of that goal, right? Yeah. So, to me, you don't have to reinvent the wheel for everything. And before we throw everything out, you should, or I feel like I should, ask the questions. Who, what, when, why are we doing it? Before one person or a very few people that no one even knew were meeting to discuss that this change was going to happen is decided on. And then before you know it, the whole agency has made a change. And you're like, really? Did we need to do that? To what goal? To what outcome? Right? Thank you, Richie. So bring you back to the JJPOC. I mentioned earlier in the legislation, it identifies who those people are, right? Who the people are that need to be appointed. Does that mean that they are the content expert, or does that mean they actually have the actual experience working as a probation officer, working as a detention officer, working as a nonprofit in a nonprofit role? No, But they as a leader, they as the person that's been identified should probably be saying, you know what? This is juvenile justice related. I'm passionate about it. My agency works and that's their goal. But I may not be the right person for this committee. So I'm going to appoint Devin because Devin has the history and experience and knowledge on restorative justice work. And it makes sense. And I know that the field of JJ is very much involved in restorative justice work. That would be a really good quality of a leader, right? To be able to say, but sometimes things get in the way. We don't always do that. But so the JJPOC, we have these 41 members I mentioned. They are the voting members, but all of them, pretty much all of them, have designated somebody to be their Devin, to be their person to say, you know what, this is the person that has the more knowledge and experience in this particular area. So those are the people that we're working very closely with. When it comes to the end of making a decision, and I think it was you who mentioned this, we hear from a lot of staff, or not, excuse me, a lot of the members that, you know what, I'm here to be the busy bee. I'm here to provide my knowledge and experience. But I'm not the person that has the final say. I have to go back, and especially state agencies, they tell us constantly, I can't be the one to vote. Because if I vote, that is basically saying that I, as an employee of the judicial branch, am putting my stamp on that. And so I have to go back to my leadership, and they're the ones who have to vote. So it's knowing, it's that give and take. We have to trust that the people that have been designated to be on this committee, who have been designated as the content expert, who has the knowledge and experience, that they will go back to their leadership, not only inform and keep everybody informed of what's happening, but that person who then comes to vote, who has not been involved in the day-to-day meetings, feels well informed, has taken the opinion of Devin, or has taken your opinion and your expertise and your knowledge and said, you know what, I will support this. Or they may say, I'm not going to support it at all. But they're informed. They have the information. So that's, the JJPOC in general, its membership. We have the two chairs are Representative Tony Walker and the Secretary McCall, who's the OPM, Office of Policy Management. And they're the ones that sort of have come together as the champions for this juvenile justice reform. They don't always see eye to eye. They, I think, for the most part, rely on many others to help make those decisions about the direction of where JJPOC is going to go, or where juvenile justice reform is going to go in Connecticut. But for the most part, they are the main people that we're working with very closely to see what we're going to tackle the next year or the next year after that. So leadership is very important. And then there's many other members, as I said, 41 members and their designees. Let's go on to the next slide. Okay, so with the JJPOC, as I said, you are all you're all somewhat familiar with the work. Goals, you mentioned goals. So the JJPOC currently has 5 goals. And each of those goals, which we'll go into a little later, is very focused on multi-system work. So how many of you just work within your own agency or do not work outside with any other partners? Just your agency, no outside partners. Really? Wow. Okay. All right. Well, so let's broaden.
Maybe I'm not understanding the question.
Okay, yeah.
I work with Department of Correction. I don't work with other agencies other than my agency. Yeah.
Okay. All right. So when reform happens, right? When you think about your clients, are they multi-system involved?
No.
Okay. So they are multi-system involved. And it's unfortunate to some extent, right? Because we really want to just, if they're going to be involved with any system, let them come in and get them out. We want them to be healthy, productive individuals, right? Get the resources they need, but then get them back healthy, again, productive individuals. But unfortunately, most of our population is multi-system involved. And so part of the work that we do with the JJPOC, if you look at who we are as the membership, it is reflective of the multiple systems that that child or that family has contact with. State Department of Ed, that child is involved in the educational services, has a need for educational services, but is also involved with probation. Those two systems should be working together. That child has been referred to the juvenile review boards. Those systems should be working together. That child is a female, and it's most appropriate that they're working in a specialized supervision unit. You know, multi-system involved. That child has healthcare needs. You know, again, and so when you look at the needs of that child or that family, it's not just one system, it's multiple systems. And so when you're thinking about like team or building a case plan, again, multi-system involvement, you could take that same concept and add it on policy work. You know, we may not have the client in front of us, that client may not be sitting there, but we know that all these systems are touching or have firsthand experience with that child or that family. And so the work of the JJPOC is very much, everybody that's a member there represents many of you who are working with those families. The other thing, the structure of the work. So, you know, I keep going back to you because you mentioned transparency. When you look at committees, and there's a lot, I don't know if you're aware, there's a lot of legislative committees in the state of Connecticut: education, health, child, family, elderly, it's lots of committees. And many of them may have a structure like the one that we do. It's a voting structure. We try to be transparent with our process. Earlier on, we've evolved. Earlier on, we were just trying to figure out how we're going to work together. And how many of you do that on a regular basis when somebody new comes into your agency, or you're working with a new provider, or you're working with a new team or a new unit, trying to figure out how to work together, right? So we spent a lot of time, the first part of our work, we spent a lot of time getting to know each other. There's, like I said, 60-something people getting to know each other. Each agency has its own mission, its own view of how they want to be represented, its own goals. And then, so how do we align those goals as one committee that's going to, for the purpose of juvenile justice reform, right? So we had to really structure our work. But before we could even do that, we just had to get to know each other, had to learn how we were going to communicate with each other. We even had debate upon debate about how we're going to vote. How we're going to vote. And you know, it's, I don't know, actually, I'm pretty sure that when you and Richie and Devin started together, you guys probably went through meeting agreements. We tried doing that with some 60-something people. Coming up with meeting agreements. And then coming up with voting. Who has the right to vote on this legislative recommendation? Whose feedback are we going to take? There was a lot of that, and we had a lot of debate about voting. The other thing about structure, we had, that we wanted to be transparent, are these open groups, are these closed groups? Meeting the meetings, are they, the legislative meeting that happens once every month is an open public meeting. You can watch it, come in, or you can watch it on CTN. The work groups were the closed work groups. We had a lot of debate about that. Who's allowed to be in the work group? You know, so there was a lot of that discourse. There was a lot of, you know, sort of that good, bad, indifference kind of conversation, and being very transparent. And you know what it came down to also? Power, right? Because I remember having one debate about, well, judicial branch has 10 representatives. DOC only has 3. Judicial has power in this situation. They're going to have more votes. DOC never going to get their way, you know, in the sense of what they wanted. So we had to figure out, you know, we had to balance the power, I guess, in this committee. Ranking members, non-ranking members. So a lot of this, you know, why do we bring this up? Because a lot of this building the structure with multiple systems is work that is work that you all will be part of or are currently part of. And those are questions that we should be asking ourselves when we're building a committee together, when we're talking about significant reform in the state. Shouldn't be one person making those decisions. This is a collaborative effort. We are already committed to being an open committee because it's in the legislation. It says you all will meet once a month to discuss these juvenile justice recommendations or policies or barriers. But then we all know things happen behind the scenes. And at the behind the scenes conversations where decisions are being made. And I want to make sure that my Department of Corrections is fully informed and is coming in and has a voice at the table. I want to make sure that the JRBs, you're talking about removing status offenders from the courts, not sending them to probation, just sending them to a community-based service. I want to know that the JRBs and the YSBs have a voice at the table. You know, you're talking about educational services right now, JJPOC, everything is about educational services. It's going to impact judicial and it's going to impact your Department of Corrections. Education department is good. So I bring this up because these are significant pieces of work, with significant changes that we're making. And we need to be involve all the players, the who, involve the people impacted. You know, I look at that because I know this is something, you know, how does that person who went through the system feel about this change? Are they at the table? So multi-system involvement. Creating the structure that we all feel is fair and transparent and hold people accountable. And that takes a lot of structure building, that takes a lot of communication, and that takes a lot of debate and critical discourse. And whether we agree or not agree, at some point, we have to come up with a middle ground of how we're going to move, or else we're going to be revolving doors. And that's where that building consensus is. So, you know, agreeing that, you know, after 10 months of arguing it out, this is what the consensus is, and we're going to be okay to move forward and put this into action. And know that it's not the end all be all, that we're going to continue to evaluate our system, and we're going to continue to look back to see, we made a significant change, did it work? Did we set out to get the outcomes that we initially wanted? If not, then how do we make sure we corrected it? Right now, we have a lot of corrections in Connecticut with some reform that we've made. In Connecticut, we're known for reducing our incarceration rate amongst juveniles. I think the last time we looked at the goal was over 50%. We've done an amazing job. But when you look at the percentage of the kids, or who the kids are that are currently in the detention centers or in the facility, it is specifically brown and black folks. That's a reform that we were successful in, but not successful in. So how do we go back and make that correct? These are the things in the sense of the behind the scenes work that we've had to do, that has taken time to do. It is not something that happens overnight. It takes months. We're now almost 6 years out. Almost 6 years out. We have evolved in that collaborative work. We have evolved in the decision making. We have, is it perfect? Absolutely not. But we've learned how to talk to each other. We've learned to communicate with each other, whether we like what we hear or not. We have learned that, right? And I'm very proud of us for doing that. Yes.
How diverse is the
Good question. Actually, I just finished completing a survey on that. Because by law, every legislative committee on October 1st, which is today, on October 1st, we have to submit a complete survey of the breakdown of gender, race, ethnicity, age, all of that. And so it is actually pretty diverse. It is, I don't think I put it, I know it's one of the, I didn't, but I do have a document that shows each, because it has to be a public document, we have to show who each representative is. And now, I will tell you, I did have several people who chose to not to prefer to answer or respond to a question. There's an option. So we do have several people who chose, and I can't say, oh, because you look this way, I'm going to select that. I can't do that. But so I do have a couple of people on this committee who chose not to respond to gender or to race. But I will say, the chairs of the committee are two Black African American women. They're the chairs. I would say our representation is pretty diverse. It is. Both in race and in gender. So in the legislation, it says, okay, the Department of Corrections commissioner will be an appointed or will be a member of the committee. That commissioner also has a designee. So he or she, he for Department of Corrections, I used to use that example, can designate somebody if you have. Department of Children and Families. So in the legislation, it actually says, it spells it out. Prosecutor's office has a representative. The Department of Children and Family, law enforcement from a big community to a smaller population community. Department of Children, Department of Education, the Office of the Child Advocate. It's quite a bit, it's quite extensive. And the most recent change that we just added, we just amended the legislation. We added 4, so a total of 2 youth and 2 parents with first and second-hand experience. The youth are to be not older than 21 years.
Are the youth voting members?
Yes, well, so this is one of those areas, so sorry, let me take that back. Not at the committee level. Talk about power. So, and I'm very open and transparent about this, and I've been open and transparent about this with the JJPOC, and I was one of those loud voices. We spent, in 2019, when we updated our plan, we said we wanted youth and parents at the table, and we needed them at each of the work groups, and we needed them to be part of this work. So we went out, established contracts with providers, because we, TAL, don't have access to the group, so we needed to work with providers who did. And they helped us with the recruitment, the training, debriefing, and prepping youth and parents to be at the table. You know, the last thing you want is them to show up and she's like, I don't know what we're talking about. You know, you want them prepared, you want them to feel comfortable, you want them to feel welcome. So we spent a lot of time working with providers and doing that. That group came up with their own recommendations for the first time in 2020. Came up with their own legislative recommendations. It was voted in the committee, the JJPOC. I'll talk about the process later. It was voted in the committee. They said, absolutely, we want this. We want these youth. We like the recommendations. And one of the recommendations was that they will be voting members. So not just sit at the table as a face. Last thing we want, right? We want to have a vote. The committee itself said, yes, they all voted in support of it. It gets through the legislative process and it's removed from the legislative package. That recommendation, that section in the legislative bill got removed. We didn't know about it. This is what, and we'll talk about process later about that behind the scenes secret meetings that we don't know about. That was removed and it was extremely disappointing. And I will tell you, it was one of the hardest phone calls to make to that group who was meeting regularly to tell them you will not be a voting member. And you know, one of the best things, the best responses they had, they held, and Evan would love this, they held a visioning session with the JJPOC. All 46 something members about that particular recommendation and why was it removed. Nobody told us. We spent a year working on it. You said you wanted us at the table. You said you wanted to give us some power. And then it didn't make it through the legislation. So right now for 2021, it's not in there. We're going to try again for 2022 to give them the right to have a vote at the legislature. But I was so proud of them for having a visioning session because that was very tough to do. And it was good for them, the legislators and the state agencies and the nonprofits and the advocates to hear from them about how hurt they were that was taken away from them. So they're still with us, they're still working with us, and we're gonna try again in 2022. Real quick, and you know, these goals have evolved. I love your response about goals because that goals sets sort of your direction, right? Without that, you could be flying around everywhere and not know where to go.
Goals and outcomes. Goals and outcomes.
Exactly. Yeah, and that's when you think to yourself, why didn't we didn't achieve our goal? We didn't, you know, we ended up doing this instead we were supposed to do that, or we were trying to aim for this. So right now we originally had 3 goals: reduce incarceration, reduce recidivism, and increase diversion. We removed recidivism. Can somebody tell me why you think we removed recidivism? recidivism in the justice system is what? Probably one of the most important things across the board, right? Judicial people, DOC people, what do you hear a lot of? Reducing recidivism, right?
I was gonna say, recidivism, is it a good barometer? Because recidivism could be anything, could be more police, over police, certain neighborhoods. So there's so many outcomes with recidivism, you know, so is that a good measuring stick, or do you look at the more long-term goals? Do you kind of look at the holistic rather than, you know, some.
Yeah, well-being. Well-being of a
well-being.
child, well-being of a family, well-being of a community, right? So from small to big, right? Yeah. Any others? Why would we reduce recidivism? Why would we remove recidivism as a goal?
Us big picture is we incarcerate less kids, but those kids will receive prevention and more support.
So thank you. All of those are, those answers are correct. So there was a lot of debate on this when we were going, we went from 3 goals to 5. Of course, there was a lot of debate as to whether or not we should keep reduced recidivism, because across the board, that's what judicial is about, that's what DOC is about, that's what a lot, the justice system. But what we determined was that you're right, there's multitudes of ways to see what outcomes are from your whatever change you're making, right? There's multiple ways to determine that. And recidivism is one indicator. Really, it's an indicator, it's not a goal. It's one way to measure the success of that reform. To measure the success of that family unit, that child, that community, that program, it's one way to measure. It's not the goal. The goal is we do want to limit the number of kids coming into the system. On the adult side, on the young side, whatever. We want to reduce incarceration. We absolutely do. So that didn't change. Right sizing of the system. We want to make sure that the young end, the adult end, not the adult, I mean like the 21 to 25-year-old end, are being appropriately serviced and identified appropriately. We want to limit, we want to increase diversion, absolutely. Now, the new one in the most recent JJPOC is number 3, RED. So in the initial, this is our 3rd strategic plan. In the 2 first strategic plans, RED was a value statement. And we kept saying in the teams that we would meet in a group like this, we would say we need to look at RED, racial and ethnic disparity. We need to look and evaluate how our laws or our policies are impacting that. And we would bring it up once in a while. Somebody would bring it up. Did anything happen? Did we put any action into place? Did we talk about it more at length? No, it was a value statement. So one of the significant changes we made was that we decided if we're going to create an impact in RED, we needed to make it a goal. Because we've been successful with JJPOC when we assign a goal to it. We've been successful. And so this is an area that is not easy to do, but it's an area that I can tell you we're in the process of updating our now 3rd iteration of the JJPOC strategic plan. Will be released in November. This goal, all of these goals will remain, but that goal is something that we're working very comprehensively on. Okay. Any questions on these goals? Okay, you can fast forward this. These are because I do want to get to the part where you're all working. Okay. So real quick, I do want to get on the part where you're looking at so one of the questions was, how do we do this work? Who's at the table? How do we argue? How do we communicate with each other? How do we deal with the discourse? And so I want you all to have an opportunity to look at some of the exercises that we do with the JJPOC. But just want to show you a big picture. This is the flow chart. It's a little deceiving because there are more groups. There are more subgroups. We just didn't have enough space to add them to the table. But this is the overall org chart. And when we talk about structuring ourselves, we had to do that because there was so much work. And we needed to figure out who is it going to be assigned to, who's going to take the lead, who's going to be our champion, who's going to hold us accountable. so forth. And so we needed to structure ourselves. So the best way to get this work done is there's the JJPOC, which meets once a month, and that's the 41 members that is written in legislation and or their designate. The executive committee, we needed to have a decision-making process. Remember I told you we spent months debating on who has a vote, who makes the decision, who decides on which recommendations to move forward or not. There's a lot of debate around that. And see people feeling like it wasn't transparent. Like, I don't know, Deborah's making a decision, she's bringing a recommendation to the JJPOC and I never knew about it. Terrible. So we had to come up with an executive committee. That executive committee is made up of representation from each of the state agencies and the co-chairs of the work groups and the youth and the parents. And so they meet on a case-by-case basis when it's time to make those decisions. And the expectation is that those executive team members are informed, that they have read the information, that they are ready to make the vote. These groups here are assigned a goal. So the diversion work group focuses a lot on the diversionary efforts, which was goal 1, incarceration work group, goal 2. We'll talk about education later. The racial and ethnic disparity work group. And then here's the community voice, and then the cross-agency. We can't do anything without data. We need data. We need to know what the system looks like. We need to understand how many youth are involved. We need to understand what services they're getting. So we need the data. So that cross-agency data sharing work group is there as an administrative function to help each work group make appropriate decisions based on the data. Okay. And there's a whole bunch of subgroups here. And so if you want to get a glimpse of what we're targeting right now, we were successful in 2020 in raising the age of the minimum age of jurisdiction to 10. We initially wanted to go to 12, but there was a lot of barriers to that. There was a lot of debate. There was not any consensus. And so we had to negotiate. And that's what happens. A lot of negotiation. And that's, a lot of behind the scenes meetings. And where do we get consensus? So where do we get the consensus building? Where can we be successful? We had to give up. It took us 2 years of working on doing research on the raising the minimum age and why children from age 7 should not be going to courts. At the end, we had to meet in the middle and we decided on 10 through the legislative process. But this group wants to come back in 2022 and try one more time to raise it to 12. Maybe it's a phased in approach. Right now, the legislation says 10 and it became effective as of July of this year. So this group wants to propose maybe 2 years from now. Let's see how effective raising the age to 10 is. And we're not talking about a lot of kids. We're talking about 100. I think the last time was 112 kids a year that go to the who are in the age between 7 to 10. Not a lot. So I think that it's not going to over inundate it's not going to over inundate the system. Majority of these kids are connected to DCF. That's the more appropriate service. That's our belief. That's my belief. Than being information. NYI, York. The DOC people know all the work that's probably been going on with. Oh, let me do one carve out here. I forget this one. Richie, I forgot this one. I do this all the time. You may hear things in this session that you didn't know about. I unfortunately do a lot of these presentations and I always get a hand raised that somebody says, I worked for that agency and I had no idea that this is so that this, I didn't know that this law changed. I didn't know that this is the work that the state was focusing on. And I always say, I'm sorry. My intention is not to surprise you all. So yes, you may hear something here that you are maybe directly impacted by, and apologize. And a good, sort of characteristic of good leadership, whether it's from your top commissioner all the way down to your own personal supervisor, is to keep you informed of what's going on. And I really do believe. So I apologize if you do hear some things here for the first time. NYI in New York, we've been working on this for years now, one, how do we improve conditions at NYI in New York? Or should those youth be at NYI in New York? I'm talking about the younger population. I'm talking about the youth. So it's been a lot of conversations, a lot of meetings. We know that there's a lot of good work happening in NYI in New York. There is a big tug of war right now. I don't think it's a surprise to any of you when I say there is a big tug of war between what certain individuals want in Connecticut is no, let's not have those kids at NYI New York, and move them to judicial, move them somewhere else. There's the other tug of war is like no, DOC is doing a great job, and they know what what more we need to do to improve the conditions at NYI New York, and we're going to do that. So it's a big tug of war right now. When education, for those of you, and I'm looking behind, because I know that you are 100% involved in this. So if you haven't heard this yet, it was released in September. Apologize if you didn't. But moving forward, as of the beginning of 2022, the Department of Children and Families will have oversight of educational services of children in juvenile justice facilities. How many of you have heard of that? Yeah, I'm sorry if you haven't heard that, and that's a big surprise to you. They will have the oversight. They will not be providing the provision of educational services. Those agencies will still be providing the educational services, but the Department of Children and Families will provide the oversight. They will be creating a standardization across the board for any child who's in a JJPOC facility of what the educational services should look like. There is a lot to call. We just released our, we worked for almost several months, years, actually a year, worked on putting together an implementation plan that was just released in September. And they will be hiring individuals for this new educational unit and to be implemented in 2022. Some more information to come on that. And really the educational services focus on these things right here. Yes.
Is it going to be somebody from the department or they'll contact?
So that's a very good question. So right now the department has decided to create their own unit within the Department of Children and Families. They're going to have its own superintendent, its own, I don't even know if they're calling it superintendent, I can't remember right now, but they're going to have their own unit. And that unit will be working closely with judicial branch detention centers, with the residential community secure facilities and non-secure facilities, with the Department of Corrections for NYI and more, on all educational services. Yeah. Racial and ethnic disparities work group is really working. There's a lot of things there that we are in a big divide right now. It's no surprise to you all probably about the controversy around law enforcement within the schools. There's a lot of debate right now. Should they be? Should they not be there? Where police use of force, we're evaluating that right now. There is that group is right now in having heavy conversations, and it's intense. And not everybody agrees. In fact, we are sort of on a lockdown right now, like on a standstill. We have not come to agreements on any of these three areas. So we've got a lot of work to do. So this is, a lot of informing ourselves, bringing people from other states to help us as well. And then you have the community work groups and so forth that we constantly work with them to help us, to give us feedback. Any questions on this chart? Like I said, you might have heard some things. Apologize about that, but thank you. All right. So things for you to go, in the sense of the flow chart and how we do our work. Everything is a vetting process, is a back and forth, constant communication. Constant communication is critical. And in order for us to come to a consensus, we have to have that debate. And we would prefer to have the debate in the work groups than have the debate in front of cameras. That's just the truth. I prefer it that way too. But sometimes we need to kind of put people publicly out there. And so sometimes we have those debates in front of the camera. Yeah, go ahead. You can move forward. Okay. So two things. I want to give you all, was it in your binder?
Yep, they have all the material.
Okay. So let me give you an example. And I do this every session, every cohort. We take two policies that we're looking at. We're looking at the raising of the minimum age. Like I said to you, we were successful in 2020 to raise it to 10. We would like to raise it to 12. The group has decided, we just met with each of the work groups about which specific tasks they want to tackle in the new legislative session. In order for us to tackle something in the new, those recommendations have to be complete and presented and voted on by January of 2021, because we give the package to the legislators and the legislators go run through it through the legislative process, and then we have the public and all that. So, excuse me, 2 pieces of legislation that, or recommendations that we're looking at that we want to tackle: raising of the minimum age to 12. Want to go for that again. The second piece of legislation has to do with, and this is a little controversial, and I again apologize, is it's improving conditions of incarceration, meaning use of chemical agents, use of solitary confinement and so forth, in the facilities. And so you can move forward. Sorry, keep going to the last 2. Sorry, thank you. Okay. And so those are the 2 areas that I'd like you both. I created worksheets. I'd like you to make sure you can, if you want to safely kind of turn around or however you want to do that. Take a look at that, those 2 worksheets. You don't have to do both.
Yeah, if one, we're gonna separate, so one group will handle the chemical agents and the other one will be racing them.
Yeah. All right. So one group, maybe this group, this side of the room, if somebody, this side of the room can do the raise the minimum age to 12, and this side of the room can do the use of chemical agents. And take a look at it. So one of the things in the worksheet, it gives you a portion of the law. I don't want to give you the whole law because it's a lot. It gives you a portion of the law from the top. And then it has a list of, I've provided you with fact sheets. You don't have to go through all of that right now, but those are good information for you to have in the future. And in the back, it has a list of policy questions. These are the questions that as we do as an exercise in the work group, when we're with the co-chairs, when we're first trying to figure out what we're going to tackle for the next year. These are some of the questions I ask them, especially when we're having a debate about something, and we cannot meet in the middle. And we need to have that consensus building, and we need to be collaborating, and we don't have to agree, but where can we agree on what we're going to tackle? And then figure out the nuts and bolts about it through the process. So those are some of the questions that we ask. And for full transparency, we also try to ask those questions of the larger public. Because here's what happens. If we're just constantly asking the same group, it's the same thing over and over again. We need to be reaching out to the general public, the others who are impacted by this change. And we need to do a better job of doing that. Reaching out to the teachers, reaching out to the superintendents, reaching out to the case workers and so forth. Reaching out again to the youth and the parents. So take a look at those questions. Take a look at the problem that you've been given. And then try to answer some of those questions, and then we'll open it up as a group discussion. So, 10 minutes? Yeah.
You guys want a separate space to work in, rather your own 2 different rooms, so you can be loud as you want and turn around, or are you gonna stand there? You're gonna stand? Okay. Okay. All understand what your assignment is?
So, and I think if this group is 2, then maybe, I'm sorry. Maybe the 4 of you and then maybe 3 of you. Is that good?
Can we raise the age?
I remember when we was
No, I like just through the JRE, there's only 3. So we have so like
this is something that's separate. So we'll talk to Stern tonight.
Or you just have it, so the manager stuff. So it's a very like, you don't fit in the muscle.
So that's our. Yeah.
So it's hard. She decided from her PhD student at there's this, but for design schools. That is yeah, because I remember right before the pandemic in the diversion with there's that SRO and there was an SRO and it was like, oh, we just reopened the same SRO organization. There is a national pattern of SRO. They usually presented as they were not excessive, or kind of ripped them apart. There's questions that are real, and they're like, oh, of course. Actually, she expects the presenters to be that like afterwards, after I asked the whole conversation. Yeah, she had like a really big impact. She asked a really tough question, but someone who asked this man. So I think you can buy into her perspective on her to be president of the school building. I remember her saying they just brought that back together. Probably together. There was one thing. Yeah. So I would love you have a model.
Yeah, because I looked at a few of them last week or 2 weeks ago, and it was just like.
Yeah. This. more than anything else is like they have really well trained SROs who know their discretionary power. They know they can walk in and say, hi, administrator, I see that you would like to see the arrest. I don't have to arrest them. I only have to arrest them if they do this or this. There's two things that I have to arrest them. Otherwise, I have discretion. I can decide to react to you and handle this. And like that's really what okay, let's just the situation, process what happened, let's see what is the perpetrator. The SROs and the SROs all got they think they're a little different, and the SROs in Britain, they don't have SROs, they have security officers, and their security officers are really de-escalation officers. So like one of them that I work with primarily is former corrections. So he walked in and he was like, and he left like 2 seconds, like, this is better. So his main role is he goes to a room and happens, and so he de-escalates the youth as well as the adults. Often walks in and then and like public shaming, and that just like brings it up to fire. Yeah. So he's learned to be like, I hear you. This is not the time for us to have this conversation. We will listen to it another time. I need to stop talking to them, and we'll take you in the room and he's so good. You'd be like, oh, okay, so let's find out. I am not here to tell you you did something wrong. I am not here to I am not here. I am only here to take your simply from here to go see if they have a CCBA formally manage their and how the picker of positive interest. So instead of being the independence day, it was for them to rebuild themselves. And Aaron, the guy here, is amazing. So they landed in the right hands. But he was literally spent to walk. The whole goal was just to make this kid feel respected. Because often when people interact and they go to escalate. So he would de-escalate, bring them to Aaron Bodie, the PCBA, sort of having a meeting and do all of the sort of reflecting on the behavior, why it happened, how the behavior set, and then they wouldn't return the kids to the classroom until the adult and the child, or the child, whoever had the conflict, met and handled the situation and were able to like be done with it, and then they would be out of the classroom. All of that because of good school-based security and officer behavior. All of that requires training. I was just thinking about that training. Like we trained them on the assertive model, and in Bristol, we trained them on the assertive model, and so then all the officers got in. Actually, the chief marshal, the mayor is married to an SRO. He came back. He was such a lovely guy. I really like that sort of stuff. What happened? I yelled at her. Get out of my podcast. And the guy was reading it.
Well, that's just some references for
I was like, okay.
oh, yeah, so I think
He's like, well,
that's
yeah, that's thing. Yeah, I thought.
that's
I could rush the selfie police officer right now. Like, you see his face. I just tell him so I stopped and asked him for so this is a customer that this man absolutely furious, screaming in his face, and when you have a dirty and someone comes out with that energy, you get, oh, let's go. He said, and I sat with my son. Can you tell me what happened? And I told him, he just talked and explained, and he was like, legitimately, this man talked to me before he left. He said he'd never been handled so well, and like he talked differently about the situation. That was yeah.
Imagine what it would be like if those people.
Yeah. Shut up.
I just feel like a lot. Getting this minimum
Maybe that's what we look for money. I wanted to have. SBI works with mostly educators. It's mostly in the terms of educators. It's not focused treating and coaching for SROs. But SROs have way more power for higher level offenses. So like in my classroom, I've been thinking about scholars who are an aspect that would we be training. That would be the thing. I want to know all.
See, that's the thing.
Learning to work on your behavior. And those are all routines. Yeah, so behavior, you do feel it, it doesn't always mean it's true. Yes.
Well, that's it. Yeah.
Oh.
Yeah. All right, everybody.
The first one.
Yeah, I know. What's it say?
All right. We're gonna reconvene. And we're gonna start with probably what I consider to be the most controversial policy recommendation. And let's start with the chemical agents, because that always is the most controversial. And so some of the work, again, these, I just want to remind everybody, this sort of exercise here, this is, and think of this as you all are a work group. You are all representing your own agency. Okay, you have your own goals, your own vision, mission. You have the experience. And as I always say, you are the better suited to provide us guidance. So that's why we're not the ones answering these questions. I'm not the one going in there and saying, this is how we're going to do it. We bring a group of diverse representation, multi-system representation. The only people that are missing here are the people that are most impacted by this recommendation. But in our work group, we have those individuals at the table. We're also in a space of learning. So for some of us, we may have more experience in the facility as an MYI or a detention center. And for others, we work in the education system or as a community provider. So we have to have good listening skills, right? We have to, in order for us to get to a place of consensus, we need to be able to hear each other out. Good, bad, indifferent. That discourse, that critical analysis, that differences of opinion, we have to allow that space to happen. We have to be able to listen and at the same time learn from each other. And so that is something that we try very much in the work groups. And we're at a place now we've evolved. We've established that. It has taken us a long time, but we've established that critical step in this collaborative work. So just want to remind us all around that, so you all sort of represent somewhat one of our subgroups, okay? And okay, so chemical agents, good, bad, indifferent, however we all feel, let's take a space to learn, okay? What are your opinions? First, just off the top of our head, because we want to get through the feeling pieces of it, right? Because we cannot get to consensus building either without recognizing where sometimes we all feel, whether our own personal opinion on something. I as an individual, and I hear this a lot, actually, I'm sorry to put the state employees out there. I hear a lot of the state employees say, my agency stands here, but I, as an individual, feel this way, okay? It's not good, better, or different, but that's, So, so let's get the feelings out first. Chemical agents in use as a tool in facilities. Overall thoughts?
Different, because I don't know, I have had to. I have been staff or different staff. I know from working in different types of techniques, hands-on techniques, but we were highly recognized for those as well, so indifferent.
Indifferent, okay, indifferent, so good, different. Because not knowing enough information, having some gap in there in the information. Others?
After reviewing the information provided, I'm drifting towards elimination.
Okay, so you got a hold of some information, kind of might have changed your thoughts around it a little bit and towards that, okay? Others?
Just from experience, just being a police officer, I've never pepper sprayed, shot, or youth. I've always taken hands-on. Actually, spray a chemical agent and I feel that's more effective.
All right,
For some, that's kind of they would be more. They might not be traumatized by it. So that's just me.
okay, so from your work experience, and thank you, yeah. And thank you for incorporating the trauma impact for in either of the, whether it's the chemical agents or even hands-on, right? If there's some possible trauma impact from them. Others? Okay. So again, just kind of want to get feelings out there. You don't have to voice, but you may have your own personal feeling out there about this topic. Okay, so what you see in front of you is a recommendation that we're, an act that, so let me just take a step back. As you all saw in the chart, we've been trying to work with MYI and your staff, DOC staff specifically, about improving conditions of confinement in MYI and York. And also, I just want to say too, even in the detention centers, I don't want to leave that out, but that seems to be the targeted area of focus. Even in the detention centers currently do not and have not for many years not used chemical agents, but they do use a whole and so forth. So improving conditions of confinement. What has happened was there was a lot of debate. We were getting ready to put a recommendation forward, and I think you all saw that in the document, a recommendation really to prohibit the use of chemical agents in these facilities. And we couldn't get anywhere in the middle. And so there was a lot of debate, a lot of different presentations done, reviews nationally, what other agencies are doing, looking at our own data in Connecticut, lots of conversation. And so at the end, what the consensus, where we landed after the legislative process, was that we would work with the Department of Corrections, or the Department of Corrections really will take the lead, to reviewing their use of chemical agents, to reviewing national standards and looking at other state agencies across the country and how and what they do in times of situational crises like these. What kind of tools do they use to minimize these type of situations? And to come up with a set of recommendations for consideration for 2022. And this is what's currently in place. And we actually got the Department of Corrections, we've been meeting with them very frequently. And so the questions before you, and so the group that had the chemical agents, okay, and I think you all did too, right? Yeah. Okay, so if you want to just let me know, overall, well, I kind of just answered the question, but I'll just, what's the objective of the first, the policy of this particular, what's the objective? To eliminate the use of chemical agents. Okay. How do you feel that the policy, by eliminating, if you're saying to just eliminate the use, does that address the issue? Is it going to be helpful? What are your opinions? What are your thoughts? How does the policy address the problem? alternatives, right?
The policy's not gonna prevent the outbreaks from happening. though. Wait. So
Not
your
prevent the
policy is
outbreak.
not gonna really affect what's happening in those scenarios. You're just gonna have to find out.
So the environment itself, right? The environment. So we're just taking one thing away. Hopefully we'll come up with alternative strategies. But that may not necessarily mean that the outcome of it is that you're not going to have these incidents. It's going to decrease the incidents, right? So you're breaking down that policy further. Okay, so who would be impacted if this policy were to proceed? Staff. Yeah, the clients, inmates, yeah, clients, residents, inmates, staff. Will it benefit the population negatively or positively? And I think it kind of, you answered a little bit of this there in the sense of the environment. We don't know what the outcome may not necessarily by eliminating doesn't mean it's going to address incidents of happening, right? So that's one outcome to this. What else do you all think? How will the population benefit from eliminating these employees, whether it's the clients, the inmates, or the staff? Is there any benefit to them?
This is the anxiety of an offender thinking he's going to get sprayed. So the trauma reduces that. Also, for staff as well, at the same time, too, by how it would affect staff. So staff are more likely to be hands-on. Sometimes we say these YOs. Sometimes they have outline of 6, 8 pounds that you can't put your hand on,
Yeah.
no matter what. So sometimes that's a tool that we need. So it benefits as opposed to cons. Sometimes it's better to utilize this tool to get them to break up, to separate. And that way staff can go in there and stabilize as opposed to having 15 staff when we jump on a pile of 2 offenders and staff are gonna get in the wild. It's a pros and cons.
It is a pros and cons, and you're right. And I have heard many times through working with this subgroup about some of these outliers. You are, look, my husband's been is 6'2" and he's been 6'2". I don't even know how long. You know, he's a bigger guy. I couldn't imagine trying to pull him down like that. Yeah, and then add anger, trauma, add your own response, and then even the staff's response, and that creates a different type of environment, right? That state of crisis can be more escalated. Yeah, I can understand that. Yeah. Okay. Okay, so how will this policy, if you were to work for the Department of Corrections, how will this policy affect your organization and the work that you do? So we just talked about just the clients, the inmates, or the staff. But what about your organization? So you got to look at this at a macro level too, right? So we're not talking just about the individual micro people, micro, but at the macro level, what the impact to your organization as a whole?
The impact that training models use for staff.
Use of force?
I'm not on your side, but yeah, I was just thinking use of force.
Use of force, yeah.
If we've got what we're able to do, but then you get like that wave of I have no control or I can't do it, and then it seems like maybe there's more incidences or.
Oh, there will always, anytime you change something, all of a sudden, that next reporting period, you will always see an increase. Always, it always happens. You will see that glitch, right? That bump. Yeah. Or that decrease, significant decrease. And you're like, what happened? Where did they go? Yeah. Okay. Other thoughts about an organization, as an organization, big picture. Wow.
Which is the stages that we have down. Maybe then the agency and how do we start implementing that? If we decide, okay, let's try. Smaller, another plan.
Yeah, it's a ripple effect, right? It's a ripple effect. So you're kind of getting into this to the last 2 questions. So top of your head, we eliminate tomorrow, the legislation passes and says effective January 1st, no more use of chemical agents in a facility. what are, top of your head, sort of the biggest challenge that an organization would have? Staff buy-in. Oh, that's a good one, yeah. Staff buy-in, yeah. Staff.
After, if I can move, and I haven't been trained, efficiently in an alternative, then even if I'm trying to have that unintended consequence, I can win the wrong first.
Yeah, very good, yeah. So then what do you think are the solutions to staff attitude? Or the staff, the morale, the morale. What are some ways in which you would try to address that at an organizational level or at a department level?
Education, right training as much as possible. The staff that face time that they want.
Yeah.
Show the data. I've been with the agency 28 years. And I probably just kind of 8 times in my career.
Yeah.
Always going to IPCs, go try to get the best training, but the escalation. Build that face time, hear them out, but that's all we want.
Yeah.
Here now that this passes, outside of our as an agency is, they would go to adults.
Mm.
We have a lot of mental health. Yeah, this is the term. It's not abuse like people think. It's pointed out. We only have 4 cases at MRI. It's not something that's readily needed.
Well, and that's why looking at the data is very important, right? And that's why also, and we're going to raise the minimum wage, and thank you for all of that. A lot of the things that you all noted, those are the things as a group, right? Multi-diverse system group who work with the same population, one way or another. Your system is working with this population. They might have been at probation. They might have been at, JRB, then push probation, then to MII. We hope that that's not the case, but it could be that way. You all have some kind of contact with these children and you individuals. And we, as a system, come in here as a community-based work group and trying to figure out how do we resolve this? Do we need chemical agents in the facilities? Well, what does the research say? What does the data say? How often are we using it? What are the alternatives to this? What does it create if we put in a different alternative? It's going to have, or different strategies are going to have a different outcome, meaning like, yeah, we're not using it, but guess what? We're having more incidents, or I can tell you from the research I've done on this, when a facility has prohibited the use of chemical agents, staff will get hurt. That first year, we will have more incidents. Staff are going to get hurt. How do we feel about that? How do we equip our staff, even though we're going to train them? How do we feel about the fact that there might be a spike in incidents for staff? We want to keep our staff safe. We don't want them to leave. We want to train them. We want to make sure where the environment that they're working with, they feel a sense of being part of a healthy environment, right? It's a lot of questions. And this is why this has not been it's not been an easy recommendation to put forward. And this is why we have another year of saying, no, let's have the Department of Corrections continue to work on the research, continue to get answers, to continue to collaborate with others to figure out how we can make these changes. Here's the other thing. We got to make sure that all the right players are at the table too. We need to be thinking outside of the box. Are we incorporating mental health services? Are we incorporating trauma-informed professionals? Who are we working with at the table? Because we can't be a closed group either, because we all don't have the answers. And so we may need to talk we need to talk with other people.
I would say I like the pressure that sometimes is put on the agency because it forces us to look beyond. We get so conditioned.
Yeah.
This is how it's always been.
Mm-hmm.
That we don't look at it.
Well, that's the accountability piece, right? That you've all mentioned before. There's an accountability measure to that. And it's a checks and balance. I think somebody mentioned that before, too, checks and balance. And it's a good practice to have. We should be analyzing our policies. We should be looking at the data and trying to figure out other better ways to do this work. Okay, thank you. Raise the minimum age. Yeah, go ahead. Yeah, and we've actually worked with several different sort of national experts who do this, who look at this and study this across the country and internationally as well. This is probably our third iteration of this now, our third attempt, and we learn something new every time. You know, it has not been an easy piece, but you are right. How are other states doing it? Have they been successful in the implementation of it? What tools are they using? Alternative strategies? Also, our neighbors are, across different countries. How are they doing this too? They're actually a little bit more liberal in other countries around this area. So we couldn't, even though we looked at those great practices, it would be very difficult to implement some of those practices from other countries here. But yes, we are absolutely doing that and pushing for that. Okay, raise the minimum age group. What did you, first, feelings. Let's talk about the feelings. Open it up to anybody. Feelings. We want to raise the age. We just raised it. We were successful. Raised it to 10. I mentioned to you, and I think it might be in the fact sheet. On average, we're not talking about hundreds of children. We're talking about 112, 150 kids a year who are referred from the age of 7 to 12. Age 7 to 12, not 10, 7 to 12 to the justice system. So we were successful to getting it to 10. It became effective July of 2021. This group wants to go back and try again for 12. Big feelings first. What do we think about children that age group? Referred to the justice system. Raising. Others? Juvenile court is not the venue, is not the appropriate venue for 10 to 12-year-olds.
What I see every day, just not.
Other feelings? Yes.
So it's tough, right? Because I think the trauma starts when the officer already issued the summons to a 10-year-old. They have to go through that process. Then the second trauma part of it is coming into our court for us to then divert, right? So, but I think of raising the age to 12, perhaps 10-year-olds, that's purposely an the kitchen thing because this is hard. Luckily, the officers were skilled enough to understand this, that there were going to handcuffs on them, all that, did all the appropriate steps. Having family steps, kids still have to go through several court hearings only to then have CCF services. So it's just, I think that has to be another level to that because the incidents are still going to occur. And then the response is how the response
Absolutely. And there are, and so again, similar to what was answered earlier, looking at the data rate, right? How many of those 10, let's just say even 7, because that was the age before, 7 to 12-year-olds are committing those serious crimes with an even smaller number, yeah. And then, well, we'll talk about, I'm not going to give answers here. Hold on, I can get right into it very quick. Okay, other feeling statements.
I feel that it's more accountability to the parents.
Okay.
So,
Accountability to parents. That's a very controversial one we can talk about too. Yeah, go ahead.
From the treatment side, we often prepare and accompany families to court and we work with them. So we see the anxiety building up over the course of the week and how that impacts the entire home system as they're anticipating what's going to happen in court. They don't know the lingo, they don't understand just what's going to happen. So now to us transporting the family there, translating the jargon. So, and we deeply value court, and a lot of the times
They don't
They don't
understand.
understand what just happened. So
Yeah. A lot of times they leave there, and I had this with status offenders too, they leave there and they say, so I'm on probation, like, no. So that's a whole other level of educating and debriefing. I'm happy to hear that you now do that to the debriefing piece of it after an appointment, that's great. All right, so great, a lot of feelings around this. Then multiply that by the statewide conversation, it can be pretty intense, right? And I will tell you, one of the biggest things that comes up when we open this up at a larger forum is accountability. Well, these kids committed a crime. I don't care if he's 7 years old, 8 years old, 9 years old, and listen to me, I'm saying he. I have to check myself too, but our data shows it's he in the system, right? A lot of times. But many times it's like, well, that child committed a crime. Then we look at what the offenses are. We look at what happened, learn a little bit more about this child, and learn about what was happening in the home. So it's like taking a case profile, right? Looking at that profile of the child. And like I said, it's very small cases that we're talking about, you know, of that serious nature, like the example that she gave. So again, objective of the policy, raise the minimum age, right? Get them to 12 and get them out of the JJ system, out of the courts. Do you think that that addresses the overall problem? We're going to raise the age. We just raised the age to 10. We want to raise it to 12. Do you think it will address the overall problem of what's happening with that child? You're checking your head off. Go ahead.
I need more background services, give access to programming, stuff, parenting classes. There's a lot of children that
Yeah.
and like under 22, they have a 10-year-old, or 25, they have a 10-year-old that is a child, another child. So,
Yeah. Exactly. So you'll notice right in the law that got passed, alternative handling to these cases, the development of a plan to ensure community-based services or interventions and so forth, you know, because you're right, just by changing the law, what does that mean? We had a lessons learned. When we decriminalized status offenders, everybody said, okay, they're no longer going to the schools can't make referrals, and Devin knows exactly what I'm talking about. The schools can't make referrals for because this child was truant. All right, where's the parent in this situation? You know, it could be, educational neglect. So do we do a referral to DCF? But we learned the consequences by not having a robust system in place to help. This child is still truant. This child is still missing school. So how do we engage them, the school, all the systems partners to address the problem? So yeah, we changed the law, but did we actually address the issue? Right. So yeah. So if we want to rate, if we want to, you know, we're effective, or we did something, but we're only going to be effective if we create that system in place. That's the checks and balances. I think somebody mentioned before. Who will be impacted if we change the law to 12?
Court system, parents, other siblings, the youth.
Other siblings. That's a yeah, you're right. Other siblings. Yeah, the community. The community will be impacted. Other systems, yeah. Okay. How do you think? Let's just say let's put our hats where we're judicial. How do you think this system? You said it impacts the system. It impacts, you know. So how do you what's that impact to the larger system?
We were talking about like if you raise the age, it's less court case flow, less prosecutors, less probation officers, and can kind of put their services somewhere else.
Yeah.
But then it's gonna also create like a more accountability on the treatment community side. So
Yes.
when you take them out here, it's gonna put a strain on, you know, so. And parents, you know, some parents, I think we mentioned some parents lack of supervision, so it can have a ripple effect. You know?
And by the way, you know, I also want, you know, and this, I still don't know after all these years, I still don't know where I stand with this. So I'm being very open and transparent about this. I believe in a lot of these changes that we make, but sometimes there is a resource that you cannot get anywhere else. We cannot access, and that's what happened with this decriminalization of status offenders too. Parents said, but I had a family support center here, and I could send my child here, and they were being assessed for educational needs. They were assessed for clinical services, They were getting the services here. Now you're telling me I have nothing, or you're telling me to send them here, but then this community provider is not really equipped to help me here. That lack of access to resources, right? Access to services. And as a parent now, I'm like, man, you know, yeah, I don't want them in the courts, but if that's the only way I can get my services, but that shouldn't be the case. Right? It's tough. It's a tough conversation. Okay, so what are the challenges that you see? What are the challenges? What challenges do you see for the work you do as you put yourself in this? You know, if you're, or anybody who's a probation or works with judicial or works with the JRB or YSB, we've raised the age to 12. What challenges do you see? How will it impact you as that person in this multi-system world? As a provider, as an educator,
as a community provider, I know that we've had to deal with this because we've had an influx of cases. And the status offender has been in place for a while now. And it wasn't until last year that we actually got funding to hire on a truancy case manager.
Oh my gosh.
So last year was the first year we were actually able to develop policy and do something helpful for the kids. And that's, we're building on that this year again, and we're trying to push forward, you know, more impactful services. But we didn't have the staff to handle the overflow, and this just adds more and more workload to an already run down small staff.
And think about this. So you mentioned, you gave the example of truancy, but now we're talking about younger kids. So you as a community provider will need to learn more about childhood development, not even talking about adolescent development or educational needs and so forth. But now we're talking about a child, a younger child, and that development of that child looks very different than a 12, 13, 14-year-old, right? What are the challenges?
So I think that as far as the board, we're like, yes, we don't have to, they are, they're already kids. But we have to have like, we're like clubs, yeah, just so that they can handle and work with these families. I really don't see the service that really cannot access in that they need to access to other than electronic monitoring and residential and facilities, which every parent, even with their runaways, comes to our office and says, lock them up, they need to learn a lesson. And I think what the community needs and provide for this family is that you know, treatment, role play, service, where that parent is empowered and is given those tools to parent. Because unfortunately, I just feel like and we have a lot of young parents.
Yeah.
You know, we have 30-year-olds with 16, 17-year-old sons that are they're the parents. So I just think they don't have those tools. So we're going to think that we're going to be and even when you're working with a family for 2 years and our system for years and services and it's like, well, we're working on this for 2 years, but that's the unfortunate part. So I don't necessarily think that's an impact to the court in a negative way. I do think ultimately it'll be a positive impact to the community standpoint, but there's a lack of response service in order for that to happen. It's always a focus on treatment of the child.
Yeah, absolutely. And again, you know, this, you know, so if you look at this, it really talks about this, this plan to be developed, right? And again, you know, I didn't say this, I haven't said this yet, but what's in writing doesn't necessarily equate to what gets implemented. And the same thing, whether it's with the law or whether it's with the plan that the system of Connecticut has come up with, and they're going to try to put in place for children and families to have, and then guess what? The law passed 5 years ago and they're finally getting staff. The law passed 3 years ago and you're finally being trained. You know what I mean? So it doesn't equate what's written down. It doesn't equate. So then how do we hold people accountable to make sure we're not setting anybody up for failure? And those families cannot wait 3 to 5 years. They have an emergency now. They have a need now. They need a resource now. So before we make these significant changes to our law, we need to have done our homework. We need to have collaborated with you all, prepared the state agencies, prepared the community, get ready, funded, you money, maybe reappropriate money, right? So that they're well resourced.
I was thinking about the funding piece when it's rolled out and become the responsibility of municipalities, Harvard,
Yeah.
Waterbury, Bridgeport. Every single mayor and anybody running against them
Mhm.
is trying to reduce their mill rates,
Mhm.
and that means cutting of services. So if the dollars don't follow the legislation in the children
Yeah.
and the families that need the service, then somebody's going to get underserved. And I think that's where you find families saying that they need the courts to do it because
That's the only way they can access it. Yeah, exactly. That's the only way they can access it. So a concept, and I didn't bring it up here either, justice reinvestment. Justice reinvestment, if you look at this nationally, that is the big ticket conversation. Has been probably for the past 5 years. We worked with the council of state governments to come in here and evaluate Connecticut's juvenile justice system. If we've done a great job of reducing incarceration, reducing or increasing diversionary effort, where has the money gone? There has always been some money in those departments. Where has the money gone? Have we reappropriated those dollars to the community in which is going to be now impacted by this change in the law? Have we reappropriated the dollars to the educational system, which is going to take on more kids because of oversight or whatever it may be? What have we done with that money? Has that dollar followed the child? And that's what I always say. That dollar, okay, that child was in DCF, but they're no longer appropriate for DCF. Have that dollar follow the child to whatever service they are going to go.
And just to kind of in historical context, I'm just thinking the school to prison pipeline.
Oh.
They start to look at kids,
Mhm.
depending on, how many kids who fails out, they start allocating that money over to the criminal justice system. So I think as a society, we rely too much on police, social courts to raise our kids, but it's a historical content too. So this is a bigger picture that's been going on, especially inner cities. That's just how, so it's a big wave that we're fighting, but it's been historical for years. Because you can tell from that kid, whoever bombs out, they know they already put that money towards his prison bed. So I think we got to look at it also in the historical context. And it's hard. It's going to be hard to shift that.
It is. It's extremely difficult. And so, I hope, and looking at the time, I hope that what you got to hear here. So again, ways in which you can be proactive, be active, and put things into action is the JJPOC itself. The work groups are public. Anybody who has experience in this field or who are curious about this field and the work that we're doing can attend those work group meetings or attend the subgroups. The JJPOC, you want to know what your legislators are talking about, your commissioners, your state agencies in general about juvenile justice, watch the JJPOC, or when the pandemic is finally over, come to the legislative office. I think that's an amazing experience. If you've never actually seen a legislative committee in action, come and see them and face to face and argue things out. Argue them out, and hear from them where they stand on certain issues. So the attending or watching the JJPOC meeting, it's once a month. The work groups, the subgroups, open to everybody. And if you don't necessarily have time for that, but you want to know what's happening, we always update our website. All that information gets loaded up there on a regular basis because they're public meetings. We keep meeting summaries. We keep tabs on the attendance because again, public knowledge, they want to know who's attending these meetings and so forth. And that I should say that's only at the JJPOC level, not at the work group levels. We keep meeting summaries at the work group level, but the attendance is different. And just get involved. Get involved. You all have a direct. You are all that question about how does this directly impact your job? A lot of these decisions that are being made are somehow directly impacting your job. So you want to be informed, and you don't want to show up at this class to learn something for the first time that is going to impact you. And believe me, that has happened to me many times. And I'm like, man, I'm sorry. Your leadership head should have informed you all, because communication and transparency is the way in which I feel we're going to solve these issues. And it's okay to have discourse. It's okay not to see eye to eye and have complete difference of opinion, but somewhere there is a middle ground. But the only way you're going to get there is through transparency and information. That's my belief. And so thank you, everybody. I really enjoyed my time here with you all, and great list.
Love it. I love it. I started looking at Richie. That is the list of madman. Wow, you really got it all on there.
Trying to document everything.
That's hard to look at.
Did you get a picture of that?
Yeah,
I'm gonna
you
take
can
a-
picture that because that's some notes right there. Thank you so much, Erica. We really appreciate you coming. Everyone, you can definitely reach out to Erica if you have questions or concerns, want to get more involved with JJPOC, you can obviously reach out to me and Richie as well, but Erica's your direct line, and I think she's really passionate about policy. She's really good at it, and we're hoping that that gives you a little bit more motivation or interest, both for your capstone proposal development and